Welcome, everyone. It's great to see all of you here. My name is Kimberly Ayala. I'm recently retired after 37 years of service in the Division of Undergraduate Education, Undergraduate Undeclared Advising Office, and one of the organizers of What Matters to Me and Why. It's a great pleasure to welcome you. What Matters to Me and Why was started in 2012, so we are now in our 9th year. For those who have not attended previously, the goal of this series of talks is to give faculty and staff a chance to reflect on what matters to them and why, and share their thoughts with the UCI community. Speakers are asked to say whatever comes to their mind on this topic, and they often talk about their deepest motivations and beliefs, their views of the roles, their view of their roles at UCI, and also their personal histories and what has made them who they are. The talks have become a remarkable glimpse behind the curtain, if you will, of those who, through their daily activities, help make UCI what it is today and have helped build community, which is probably even more valued today than it was when we started out years ago. One thing that's nice about What Matters to Me and Why is that it brings together people from across the campus. Undergrads, grad students, staff, and faculty. So it is our tradition to give people a chance to introduce themselves to each other when we hold this program in person. Clearly, we can't do this now, but as a poor substitute, we thought it would be nice to break this large group into small groups for a few minutes. So through the magic of Zoom, you will be sent to a breakout room of about 4 people in each room. You will be prompted to join or deny a pre-assigned breakout room. I encourage you to please turn on your videos and join. There you will be unmuted, and we would like you to introduce yourselves to others, your name, your department, where you are at UCI, whether you're a student, staff, or faculty, or how you heard about this talk. This will just be for about a minute or two. You will receive a warning when the breakout room is about to close. And then we'll bring you back, and Kevin Bossemeyer will get us started by introducing our speaker for today.
Welcome back, everyone. I hope you had a chance to make a new friend. And if you didn't, I'll be your new friend. I'm Kevin Bossemeyer. It's great to be with you today. I am privileged to be on the organizing committee for What Matters to Me and Why. And I love the series, probably for the same reason that you're here, to hear the deep personal reasons why people do what they do. So welcome and sit back and have a great time. Just a couple of housekeeping notes. Your unmute button has been deactivated during the presentation. It'll be reactivated when we go into Q&A. So don't worry about that. In fact, during the presentation, if you have a question that comes up that you'd like to ask the speaker, just click on the chat button at the bottom of your screen and type the question, and I'll be glad to ask it for you, and I'll group the questions so it'll help with time to make sure all the questions get asked. If you have a driving desire to ask the question personally, just put your name in the chat box, -want to ask my own question, and we'll do our best to get that asked, okay? As I said, my name is Kevin Bossemeyer. I'm also a public affairs host interviewer on KUCI Radio 88.9 FM, our university radio station. And it's a privilege to introduce Dr. Chang this afternoon. A little over a year ago, January a year ago, when COVID was more of a rumor than anything, and the only overt sign on campus of anything going on was that as Asian students were coming back from winter break, there were more than usual wearing masks. And I actually stopped one on Ring Road and said, why are you wearing the mask? And he said, just in case he was contagious, he didn't think he was, but just in case he didn't want anybody else to get it. And I thought that was very noble, but I was very naive. I was like, really? And I reached out to Dr. Chang to do an interview, and I could tell he was very busy, but that he personally wanted to do an interview to get the word out because there was so much unknowns back then. And as we exchanged emails to get a date, several people that he had CC'd in the email came forward and said, Dr. Chang, are you sure you have enough time to do this? And Dr. Chang, you shouldn't overextend yourself. And I knew there was a lot going on in the background, and the rest, as they say, is history. The campus closed down. By the time we had a chance to do the interview, it was mid-April. And I found Dr. Chang to be very articulate, compassionate, and he very much cared about our students, staff, and faculty, and people in general. It was very touching, and I am really excited to hear him speak today. He graduated from the University of Boston's School of Medicine, and he received his MD and also his Master's of Public Health. He's been active and in his profession for the last 20 years at such places as UCLA Health, CHOC Hospital, as well as being the regional medical director of AltaMed Health Services of Orange County, a series of health clinics. He became an anteater 4 years ago, and he is currently the medical director of the Student Health Center. So without any further ado, please give a warm cyber welcome to Dr. Alfred Chang.
Thank you for that, Kevin. And I wanted to thank you all for being here. I know it's kind of busy, crazy times, and so I appreciate and value your participation. So as Kevin mentioned, I'm the medical director of the Student Health Center, and it's actually the backdrop behind me. So this building, some of you may be familiar, some of you may not be. It's over by kind of East Peltison and campus by the police station. And this is where I do most of my work kind of on a day-to-day basis, definitely prior to COVID. So we are a fully functional clinic, and I'm the medical director there. We provide service to our students for any of their basic medical needs. We're fortunate to have an incredible team of nurses, of our providers. We have specialists that work out of this site. We have our pharmacy, radiology, our own internal lab, and we do, I think, a wonderful service to our patients and our students. We're on campus, which is great for access. And one of the more recent changes with COVID is that we're telehealth for the safety of our students as well. So many of our visits now are through the technology that we're speaking on right now, which has been a great service. So just wanted to point out to you, this is kind of the day-to-day work, but this year has been very different, and I'll go into that in a little bit. My goal today is to share with you a bit of my background. As Kim mentioned, some of the steps and experiences that brought me to where I am at today, how I really didn't plan on being here. You know, when I look back, you kind of end up where you end up, and hopefully you're brought to that point because of what you feel is right, what you feel is best, and what definitely keeps you motivated and inspired. So let's go way, way back, over 50 years. So my parents are Chinese by origin. They came to the US from Taiwan for graduate school, and I was actually born and raised here in Orange County in Los Angeles. So grew up in Seal Beach. I grew up going to Sunset Beach, playing football at Los Alamitos High School. I had a great time. My parents, so they were relatively young when they came over, so they did a good job to immerse both myself and my brother in both kind of American culture. So I was a Cub Scout, I played Little League, I did sleepovers, but also grained into our Chinese culture. So I speak Mandarin, we celebrate all the big holidays. The family unit is a big part of everything that we do. And of course, education has been one of our big focuses. So after growing up here in Orange County, when it was my next step to go to college, I actually went to one of our sister campuses. So I'm not an anteater by undergrad, I'm a banana slug. And I know there's several banana slugs out there. I know some of you. Don't be ashamed, be a proud banana slug, right? This is up at UC Santa Cruz. So very different culture. If any of you have had the opportunity to be on that campus, it's remarkable. You're basically in a redwood forest. Some of the libraries are built into the forest. You're surrounded by trees. I recall walking to my classes on campus, coming across deer, you know, raccoons, a skunk here or there after a late party. So you learn to kind of avoid, but you're living with wildlife. And I took it a bit for granted. Now, as a young, you know, fresh high school graduate, I wasn't too sure what to be when I was going to grow up. I had some idea, I have a family full of engineers. And so my dad said, well, maybe computers. So I was a computer science major when I first started college back in the day. And even though I found that exciting, there was something in me that really drew to the life sciences, so biology. As I look back in my childhood, I was a big fan of shows like, this will take you way back. So Mutual of Omaha's Wild Kingdom, for those of you guys that remember, I think it's Marlon Perkins back in the day. And of course, the National Geographic programs. Maybe I didn't recognize it, but my mom would say, yeah, you were glued to those shows about whatever, elephants, honeybees. And I was really fascinated by biology. And so after my freshman year, I did a transition from computer science to biology. And living up at Santa Cruz at the time, and my parents being down in Orange County, still in Seal Beach, I kind of shared with them that I was changing majors. And I remember clearly my mom saying, so biology, what are you going to do with biology? Be a biology teacher? And I said, well, maybe healthcare, maybe something. And she said, what, a doctor? You want to be a doctor? We don't know anything about medicine. We're all engineers in our family. And I think I was probably the only Asian kid in the country whose parents didn't want him to be a doctor. So a very different situation. The great thing, though, is that moving forward with medicine has been all of my choice. So my mom said, of course, she'll support me as you can, but we don't have family that are doctors or nurses. I said, Mom, I'll be okay. I'll be okay. So making that first step, I think, was a big change for me. And I had to retake a few courses over the summers, had to do this or that, but it was definitely worth it. And that's how I kind of went down the path of healthcare. Now I think back, so this is like the mid 80s in Santa Cruz, Silicon Bay area. And I think if I'd stayed in computer science, where could I be now? Like, would we all be buying toilet paper from albertchang.com somewhere? But you can't go back. I've loved my career thus far. I still am very intrigued in technology and computer science. And this year, above all years, have shown us that technology and healthcare really have to be more integrated. There's opportunities to be seamless there. So even though I'm a physician and a biologist, engineering is still in my blood. And so those days in college were phenomenal. Once I was kind of down the path of medical school. Now, as an undergrad, you really don't know what it's like to be a doctor. You have ideas. So I was influenced. So growing up in the 70s and then kind of in the 80s, I was influenced by programs like MASH. And you guys might remember a program called St. Elsewhere that showed a real true side of healthcare. And even though I didn't realize it as that kind of 13, 14, 15-year-old, there was something there that I really enjoyed. And so I started going down the path of healthcare, of being pre-med. One of the key experiences, though, for me at Santa Cruz, I was involved with the Greek system there. And as many of you know, that there is a philanthropy chairperson and a commitment to serving the community as a part of a Greek life. It was a big part of Greek life. And I remember one Saturday morning, I was living in the house and we had maybe 10, 15 guys living there. And who knows, people are sleeping on couches. So I get kind of shook by one of my friends and he's like, hey, let's go. I said, where are we going? It's Saturday. It's like 8 o'clock. Leave me alone. And he said, no, this is the weekend that we're going to be helping out Special Olympics. And I thought, oh, yeah, I got to remember that. And I thought, do you have anyone else that can go? And he said, well, not really. So I got up and I went, not knowing what to expect. It was kind of our first experience. We had just built a relationship with that group. So we showed up at a high school and there were dozens and dozens of Special Olympians there with their parents, with coaches. And even though we didn't really know specifically the details of what to do, we just got engaged and involved, probably about a half a dozen of us. And whether it was helping some of the Special Olympians, with their running for track, or with balancing and bouncing the ball for volleyball, or throwing the Frisbee around, whatever it might be, we had a blast. We had a great time. And we made some strong relationships and partnerships with some of these children or these Special Olympians and their families that really showed me a hands-on experience with the population. That really, I didn't need a lot of skill, talent, or of sports ability, but I was there just being there. And I remember after that experience, kind of going home, and maybe it was around noontime now, and seeing some of my friends still on the couch, still just getting up. And I thought to myself, these last 4 hours, I could have just been getting off the couch or just waking up. But those 4 hours were spent making a difference in the lives of others. And you don't really realize the potential you have to really support others in other communities. And that really hit me. I'm glad it hit me as a young adult also, because volunteerism, the commitment to continue doing things for others, was ingrained in me. And and it still was just a few of us, maybe, or a certain core group of us that was going regularly. But since that point, I've been committed to supporting, Special Olympics sites, not the sites as much anymore, but supporting them on different levels. And that was, as a young adult, kind of seeing that potential to help. And that hit me in a very big way. Now, the struggles of medical school, getting in, was probably the most challenging thing in my life. In medical school, admissions is so difficult. And the big thing for me was, I've never worked so hard to get into a program that I've had to work so hard to stay in. But that's med school, and that's a quick 4 years. But it's essential, and it really ingrained in me that this was the right thing to do. That's when I started to figure out that pediatrics was my field. So I'm a pediatrician by training. I trained at CHOC Hospital, as I think Kevin mentioned earlier, and I came back here to Orange County, and it's been a good fit. I'm kind of a big kid at heart. And this is the other thing for me growing up in Orange County, I'm very fortunate to have a very good childhood experience, and so great memories. And for me to ensure that early developmental stage of life is optimized to its maximum helps us to ensure that our children grow up to be healthy adults with that right support. So after finishing up residency at CHOC, I started practicing as a pediatrician. And this is another area where I realized the impact of what you say and what you do, even when you don't think it's working. So I was in my clinic. I was working out of the Huntington Beach Clinic, part of the AltaMed system now. And a part of, teenagers, for those of you that have teenagers and adolescents, it's a love-hate relationship. So when they love you, it's just like the best thing in the world that your teen's listening to you. But when they're turned off, when it's just like, I don't know, nothing, you don't even think you're making an impact. So it was a meeting or an encounter with one of my teens and their mother. And I was just going through the typical anticipatory guidance, talking about nutrition and education and health and sleep and exercise, the whole routine, thinking to myself, this kid's not even paying attention, but it's what I got to do. We ended the visit. There was a plan to come back next year because he was healthy otherwise. Maybe a week or two later, I remember sitting in my office at the clinic and getting a knock on my door. And it was the mother of this patient. And she just wanted to kind of just thank me. I mean, I think maybe she was there with her younger son. I think that's what it was. But she wanted to stop by and say hi. And she said, Dr. Chang, the things that you were saying to my son made a big difference. And I said, really? Wait, the son, the teenager? And she said, as soon as we got home, he started telling his father, you got to stop drinking that soda, Dad, because Dr. Chang says that's going to cause diabetes. And we already have a history. And he said, Dad, come on, we got to go out and start walking around and doing some exercise. And he's been spending time with his younger siblings. And I was just floored because I didn't think this kid was paying attention to me at all. But he was listening the whole time. And even though, I thought it was just kind of bouncing off of a wall, a dead end, it was making a difference. And so another point for me is the impact that you can make, not just by being there, but by sharing information. And thank goodness this mother came back to give me the feedback, because, maybe after a few years, I'd be like, it's not worth it, I'm not going to say anything, but they're listening. And that's kind of my motivation too, to keep doing it and fine tuning it and saying it regardless of what it seems like, because they may be picking up on what you're giving to them. Now in this day and age where it's all, social media, this and Instagram, that, and, web chatting here and there, it's a bit more challenging, but I think that, they still will listen to you. And I saw that, I felt very fortunate, number one, to be in a position to provide that care. And then to have the ability to kind of make that change and kind of make that influence moving forward. As a pediatrician, once again, I think one of the biggest opportunities is, you're speaking to parents, and behavior change is always the biggest challenge within healthcare. The physicians of you and the nurses of you that are out there know that compliance with direction and doing what your providers are recommending, even myself, have I, stopped early on antibiotics because I felt good already? Maybe. Don't tell my doctor that, but maybe. However, with pediatrics, I've noticed the opportunity is, parents hopefully value their children more than anything else in the world. That is their prized possession. And I always felt it was an honor for me to be able to take care of and provide care to their most prized possession. And I always took that, as once again that greatest opportunity. And I found that there were ways I can influence the parent's health by speaking about the health for the child. So there have been several parents that have been able to get to quit smoking because their child as an infant had bronchiolitis through a very bad season and maybe even needed nebulizers. And so to share with that father or that mother that if you continue smoking in the house, it's really going to affect your child's health. There may be scarring, there may be other implications. And even though they've tried or maybe didn't try for years, there just wasn't the incentive for them to make that change. But for the health and well-being of their child, they've been able to do it for the right reasons. In many similar ways, we know that childhood obesity is a problem that continues on with us, specifically with certain demographics and communities. And to be realistic, if I've got an obese 5-year-old that I'm taking care of, speaking to him and changing his diet is not the key. The key is the household. The key is looking at the family members, the siblings, and giving information that the household can make great change. So by impacting and focusing on the health of the child, maybe mom and dad will make the steps and changes to shop smarter, cook healthier as appropriate, and really engage in that change. So the opportunity and potential as a pediatrician, not only for the patient, but then for the patient household, is a big impactful part, and it's a huge opportunity. So, my work in AltaMed was, I was the regional director there for about 8 years, and I continued to see patients. And this is maybe another choice. So back in high school, everyone was taking Spanish, and growing up in California, you kind of speak Spanish anyway. So I chose German. So ich habe 3 Jahre auf Deutsch gelernt, right? So I took 3 years of German, just because it's kind of cool to say ich habe 3 Jahre auf Deutsch gelernt, right? Just I love the sound of German. But when it came to practicing medicine, very few German-speaking patients were coming in my door. And Mandarin is helpful, so I can speak Mandarin, growing up speaking Mandarin. But my Spanish, I should have been taking Spanish all these years. I did polish up my Spanish, so mi español está mejor ahorita, pero años antes maybe no está muy bien. So just languages and diversity of language, and speaking to patients in a language with a culture that they're comfortable with, and then understanding their culture as a part of bridging the gap to kind of trust and respect and providing care with dignity, I think is a good thing for me. And in those years that I spent in community medicine, I think were integral to my kind of personal health and my personal development and well-being. Life as a physician is difficult. A lot of issues, especially serving the underserved. So compassion fatigue, where you care so much, but you feel like you can do so little because resources just aren't there. And then provider burnout. We hear about this all the time for not just physicians, nurses, therapists. It gets to be very real. Providing care to my population. So these are typically underserved families, either uninsured, underserved, a little education, lack of resources, homeless populations. It reminded me of, how difficult life can be. And overall, they were still happy. Overall, they had the same goals and kind of aspirations for their children as everyone did, or everyone should. And it made me check my own life to say, what, these families are doing phenomenal. They're working hard. I have nothing to complain about. I'm the luckiest boy in the world to be doing what I'm doing. It's a privilege to serve them because they're the true heroes. They're working so hard, keeping their children and their families safe and sound. And, for me, I was a bachelor for a while. I just got my bachelor life, and you know what? I can't, my internet's not working fast enough or whatever. I want to buy a new car. That's no big deal at all. So in fact, treating my patients became like a therapy for me because it helped me get through some challenges that people have and really remind me of what fortune I'm in. And so I've never taken life for granted. I really feel happy about my opportunity to be where I'm at. So when I counsel, I love speaking to our pre-med students and pre-nursing students about steps and stages in life. And sometimes your plans from when you were back in college or even high school work out, and sometimes they don't. Like, for example, when I see what I'm doing now, I thought, how the heck did I get to be where I'm at? This wasn't a part of the plan, but things just kind of happen. So I speak about a few things. So, having passion about what your career is. And you can be passionate about certain things and have them as hobbies. But if you're really lucky, you can get a career, you can find a career that you're passionate about. And that for me was medicine and kind of in pediatrics and healthcare. But it's not just passion, it's also talent and ability. So I could be passionate about basketball, but being 5'8", a little bit on the heavier side, the NBA is not looking for me, okay? Or even like local leagues I'm gonna be the last kid picked to play. So I can be passionate as heck, but talent has to be there. And you can work on talent and you can build talent, but if you have talent and you're passionate, things can typically work out very well. But I started adding a third component the last few years here. And the last thing is kind of more of a wild card. It's timing. So a lot of times the timing of what your career and what you do is there or it isn't there. I am sure COVID has rocked the timing and plan for people all over this planet. Like medical school is not the same as it was before. Life is not the same as it was before. Work is not the same as it was before. Like interacting with people, families, we've all seen this. So timing is a bit of an X factor. When I look at my career, when I look at my steps, there were definitely situations that happened. And it's like, wow, if I hadn't have done this, or I hadn't have spoken to this person, or there are times when I went to a seminar, the way I became a medical director is I started working with a group called California Children's Services. And that's because I went to a certain conference and I made a contact with someone here locally, gave a business card, and she gave me a call about 6 months ago. So got called into these things. And I think if I'd never gone to that conference and spent the time to speak to this person and kind of got this card, where would I be now? Or where would my path be different? So timing is one of those things. And I feel, luck is one thing, timing is definitely there, but I also feel there are ways that you can create opportunities for yourself. So making a choice to kind of keep doors open, keeping your eyes and ears open, being flexible, being agile, being able to kind of move and bob and shake and weave where you need to. That's a part of being, I think, happy with your job and your career and your life as a whole, and then maybe even being successful, whatever you deem successful to be, comfortable with life moving forward. And so, as a medical director, there are still days where I'm in meetings and meetings and meetings. And it's like, dude, I went to med school. I became a doctor. I spent those years in residency in the OR, like all these things, to be in meetings all day, to be spending hours at a time returning emails back to people. But then it hits me and it's, well, thank goodness there's a physician that's at these meetings, because sometimes medical decisions are being made without a clinician in the room. And hopefully I can give a perspective, not just from our patients, but our providers as well. So a lot of the decisions we make impact my nursing team like crazy. Like this year has been just nuts for our teams in both nursing, my lab, and our providers. And so being able to sit at the table and being offered that seat is a true honor. And then being respected, which I think has been great also. So working on this campus, being able to provide leadership or being able to provide direction. For me, when I look back, I think I became a director because like I knew as a pediatrician, as a clinician, what were the pain points for me? What were the must-haves, and what were the, I can do without that, just make sure I got this going on. And I knew how I liked being led, and I knew kind of management worked well. And I thought if I can just do this for a little bit and help my fellow physicians get to a good point, maybe that's a good thing. Never did I think I'd be catapulted into these kind of positions. I'm what I think, I'm what people would consider as a reluctant leader. Back, I was very, very shy as a kid, so I never did any kind of student politics stuff. But I found myself being voluntold or being pushed into these positions, and maybe it's a bit of, I can think about maybe my emotional intelligence brings me to a point that I kind of understand people in groups a little bit more. So I found myself being a leader here, being a leader there. Now I've just kind of accepted it, and if people feel comfortable with me talking and sharing my experiences and my ideas and my opinions, that's great. But I never really wanted to be here. And that's kind of for many of you too, taking that step. You may not know what careful what you wish for, but your impact in the bigger picture, may come when you least expect it. And I think that's where, if you work hard, if you're passionate, I think people identify that in you, and then the opportunities will kind of come moving forward. So coming to UCI campus 4 years ago, as was mentioned, I'll be very honest with you guys, it was difficult to leave community medicine, but a lot of changes were happening 4 years ago. Think about 4 years ago, what was going on. And not that I was turning my back, but I thought this is an opportunity to kind of take a step into another area, another direction. I love the community health portion, but my role at that job was really to run the clinics and manage the clinics and the providers and the productivity and the outcomes. Kevin mentioned I did my public health degree before even starting medical school. So my master's in public health was focused in social behavioral sciences. And that was perfect for me as a pediatrician. So anticipatory guidance, making sure patients understand what needs to be done moving forward. But a lot of my focus and passion is also within preventive medicine, in population health management. And that's why coming to the university has been phenomenal. I considered maybe working at the county as the Orange County Healthcare Agency, and I've been working with them as strong partners for many years. And so that may have been a step. However, the county is just so big, and and we're seeing it with COVID and management of COVID now. You've got populations from Ladera Ranch and to like Anaheim, to Santa Ana, to Seal Beach, to Irvine. You've got so much to manage, and there's so many factors going on. What I kind of see UCI campus as is like a microcosm of our county. And the great thing about what we have here at UCI is, we are our students' healthcare providers for many of them. So we're their primary care doctors, we're their specialists, or their nurses. We're also their educators for sure. So we provide education and training and guidance and counseling. We're also, for many of them, we're their employer. So for those that work on campus, we're making sure that financially they're doing well, they're getting experiences there. And on top of it, we're the landlords for quite a few of them. So we're about 7,000 students right now. We maintain and manage where they're living. And it may seem like it's just a big crazy headache because you've got so much responsibility. For me, it's more of an opportunity, because we're outside in the county. You have the ability to manage and co-manage and support so many factors and take them all into account so that you bring all of these departments to the table. And that's what COVID has shown us for sure. So for our, from the point that we're doing testing to the point that students become positive, to our contact tracing team, to our housing being alert and aware, to our professors and instructors having notification through disability services, to student conduct for misbehaviors. There's a lot that I'm seeing that we can manage here, that we've been managing here. And it's really just been a fantastic opportunity. And so when I look back on my 4 years, it's been a remarkable kind of education and experience for me. Definitely shows me why I'm still here. I'm very happy that I got here. I think one of the biggest rewards for me is working with future leaders that we have in our students, with the change makers. I mean, these are students that are going to be making change and taking care of ourselves when we're older and need their support, but then also collaboration with campus leadership and truly learning from each and every one of you as I've been here moving forward. So with that, I need a little bit of a water break here, but why don't I go ahead and stop, and I'll open it up to questions.
All right. Thank you so much, Dr. Chang. That was wonderful. A great trip. While we're waiting for some questions to come through, and first of all, just spending time with you, I really guess, like, wow, you are a natural in your leadership. You just have this naturalness about you. So, for students that are coming up, can you talk about a particular time when you had adversity in your life that you had to overcome?
Yeah.
Does anything come to mind?
Yeah.
And before you answer that, I want to encourage everybody out there, please hit the chat button and ask any questions that you might have. So go ahead, Dr. Chang.
For sure. So, most recently, one of the difficulties was what brought me out of my previous job that I'd been doing for nearly 10 years to look for something that was different, something that was new. I mean, these are the families. So I've been at that Huntington Beach clinic for probably about 15 years. So
Oh, wow.
I've seen generations of like children, and then now mothers, young mothers having children. But ultimately, my position there was, even though it was critical and it was rewarding, it was limited in the scope. And I wasn't getting my public health perspective. And I thought to myself, and AltaMed is a fantastic company. I mean, I've learned so much from them. They're doing incredible work for a much needed population. And I thought, if I stick with AltaMed, this is a job I can continue in, a company I can continue with and retire with, because they've been taking great care of me. But I had to make a choice about, risking that security with that company and trying to find a path that might bring me to more experience and more engagement on a level with public health that I was looking for. So, I spoke to my wife, of course, thought about our options, had a bit of a plan, and then made the change to leave my last company. And it was on very good terms. But it was difficult. I think, there was some surprise. I mean, once again, because things were going very well. I made sure that, so I was the regional director, I made sure all of the site directors were taken care of, and I made sure things were all tucked in. But leaving my patients, that was the difficulty. So letting them know that I'd still be available. They find you everywhere. So they're on Facebook still asking me about, he's got an ear infection. Can I do something for it? It's like, come on, he's 21. He can go find another doctor now, right? So that was a big thing for me, is making that personal choice to leave one career for another. But that's where, and it's a gamble. You never know what it's going to be like. I didn't know if UCI would be just crazy, chaos, and nuts. Luckily, it's a little chaos, kind of nuts, but a good place to be. And I think that was probably one of the difficulties of making that choice.
Gotcha. How about in terms of growth? You've been now a doctor for 20 years. How are you different now than when you first came out of school?
Oh, yeah. Maybe some of the other clinicians can kind of know what I'm speaking about. I mean, I think a good provider is a provider that knows their limits and is not so cavalier that they can just do everything and know everything. I think it took me about probably 8 to 9 years before I was so comfortable as a pediatrician. Anything that walked through that door, I could take care of, and it's just through reassurance in medicine. I think, especially as an outpatient primary care physician, it's about following up. It's a bit of a gut thing. So, when you got in a 6-month-old that's wheezing and coughing, and a mother that's got very little resource, the decision to send them to the emergency room and the ambulance and the cost and the time, versus saying stay tucked in, he's going to be okay, and giving them a nebulizer with treatment and precautions, and then seeing them the next day. So that's the key, is the follow-up. So I learned that one of the most important tools as a clinician is following up. And so you begin to build comfort in your clinical determination and practice. And you say, okay, we can do this. And then you give that confidence to your patients so that they can kind of work with you on that also. So for me, the clinical confidence definitely came and has been growing. From an administrative level, it's been more difficult. So sometimes being the only clinician or the only physician in the room, you've got to stand on your own 2 feet, and people look to you for the answers right off the bat. With COVID, for sure. With COVID in those very early months last year, Kevin, when we were speaking about things, there were things going back and forth. And sometimes you do learn from statements or whatever's going on. I learned, I mentioned before that I was a pretty shy kid. One of my biggest phobia of all phobias was public speaking. So it was speaking to others. And what I eventually learned as I started to get into leadership positions is, if you just speak genuinely about what you know, so don't try to cover anything up, be as transparent as possible. And if you genuinely are in the right place with how you feel about the way things should be run, then just speak with truth and speak with honesty. And I think people see that. So they know that you're, even though they may say things that you don't like, or you may even make a statement that is caught back later, they know that you're speaking as truthfully and honestly as possible. And so I think that's been a lot of my goal too, is just to be genuine when you're presenting and being transparent and being open and honest and respectful in all ways.
Gotcha. We have a question here, Doctor. Do you see any differences in how UCI deals with student health, especially in the age of COVID, compared to other universities across the nation or even in other countries?
For sure. Another great point of this position that I'm in now is that I'm not alone. So all the other universities and colleges across the country and across the nation, those that have medical centers or take a medical accountability, so we're all in the same boat. On a weekly basis, I meet with my UCOP, so Office of the President holds a meeting so that all 10 campuses are represented, and we have medical directors at each of those 10 campuses. And we are like the team, we are the core. So, and we're on listservs and chats all the time about how are you guys dealing with this? How are you dealing with that? So my hat's off to Berkeley, UCLA, San Diego, all these other campuses. And so we are always sharing best practices. There are certain things that we've definitely made sure that we are saying the same thing because we are all under the UC family. If we have families out in the community that have a daughter that's at Berkeley and a twin daughter that's at Irvine, should their care, should their treatment, should things that impact their lives and their education be so different at each of the campuses? There may be some reason because of demographics or whatever, but in most cases, we should try to be as aligned as possible. Another example of that is today in the world of remote learning, where students may still be Santa Cruz students or Riverside students, but living in Irvine, Tustin, Newport Beach, because they're a UC student, they are free to utilize our student health center. So this is called reciprocity. And for our Irvine students that are living up in San Francisco and Sacramento, they can go to Davis and San Francisco's UC student health centers and receive care there. And we're always kind of keeping track and making sure to monitor things that best way. And that's always been in place, and that ensures that we are consistent. It's important for when you get to legal issues, risk management, chaperone policies, these type of things, boundaries with providers and patients. We're all along that same page. What COVID has done recently, and this has been a goal of mine for the years I've been here too, is that we have probably 24 universities, campuses, trade schools within Orange County that are dealing with similar issues. And about probably 3 months ago, we were able to bring together an Orange County College and University Coalition that meets with the county healthcare agency on a weekly or twice per month basis to go over specifically COVID issues and concerns. So, we're currently screening many of our students. We put them into isolation. We have a certain process with our athletics team, and we're able to share that with our other campuses as a best practice. Some of the other campuses are doing things with antigen testing or with follow-up or the tracking and tracing that we can learn from. And so collaborating with our other medical directors and medical teams locally here. So we are dealing with the same county regulations. We're dealing with the same kind of demographic challenges. Many of them have students from same, communities and areas that are challenged as ours are. So we're sharing that resource, sharing that best practice, kind of under the umbrella of the county, which has been a phenomenal fit. So it's probably the best collaboration that COVID has brought us together with, but we're sharing and learning so much more as partners and reaching out.
Gotcha. Thank you. What are some pieces of UCI's COVID response that have helped us most? Can you identify anything?
Yeah, so one of the things that many of you probably have seen is the communication. So we try to be open with communication as regular as possible without just inundating you. Too much communication is like you start to ignore it. It's the boy who cries wolf. But from the beginning, from last year, and I have to take my hat, I think she was on here earlier, but Bridget Lau is my nurse manager at the Student Health Center. And she is my watchdog, my bulldog. She was the one that sniffed out this Wuhan thing early last year. And she and I have been kind of focused on this from the start. And then working with leadership in our strategic communications team, we've been trying to give honest, updated information from the CDC, from the WHO, from our California Department of Public Health, as well as our UC partners and leaders. And once again, being honest about situations. And there were difficulties. So this is one of those areas where there were discrepancies. Some of the other campuses moved to remote learning sooner than we did, but we needed to do it in a smart, focused way. And then we kind of gradually followed suit. As we've been moving forward through the summer and now the winter, once again, communication through our strategic communications team, through our student affairs team has been critical. Housing expectations, the way that courses are going to be run, other resources both on and off campus for our students that are having mental health issues or other challenges, academic accommodations through disability services or through our social workers, making sure that our students know what was available on all avenues and areas. And then I think one of the biggest things, and this was a tough decision, was the choice to do asymptomatic testing. So surveillance screening for all of our students on campus has been just huge. We were able to bring back about 7,000 students on campus, and it seems like it's a large number. A typical year, we have about 16,000 students on campus, and these are undergrads, graduates, living either in dormitories or graduate student housing. But we realized with COVID, you could not have roommates in shared rooms. And so we brought back around 7 with single rooms as bedroom units. There were some situations where, a shared bathroom is a necessity. We didn't have single bathrooms for everybody. But in that way, we were able to bring back a larger number with the requirement and structure of kind of a social distancing and providing a bit of socialization. They were broken up into pods that they can go get meals together, have some level of interaction without really jeopardizing their health risk. And on top of that, we have the ability to secure about 400 quarantine and isolation rooms. So our student affairs team and housing really got together. So those are single bedroom, single bathroom units. So that when we identify students that are positive, either on campus, or even if they're living off campus and their home situation puts them at risk to others, we can bring them on campus, provide them with a single bedroom bathroom unit. It's like putting them up in a hotel for 10 days of isolation. That's been huge from our campus to be able to do that. And that's not just for the positive, that's for the quarantines. Each positive might have 5 to 10 to 20 contacts that all need to be quarantined. So we've provided a service that's there. So that's another, I think, big step that we've taken as the university to support in the face of COVID. And then one of my biggest projects I'm working on with our teams right now is vaccination. So we've been vaccinating out of the Bren Center through the medical centers, support staff. They've been phenomenal. They've been doing this longer than us. They've been doing this through the medical center for over 2 months now. And that's at this point supporting our community, our Orange County community and our UCI patient community, 65 and over. But eventually for our staff, our faculty, and then when the tiers allow, our student population, so the healthier 18 to 25 or 30-year-olds. So these are all steps that we as a university and leadership here at our university decided to commit to for the safety and well-being of our students. And even now that the vaccinations, it's for our community as a whole. So yeah, hats off once again, great respect to our leadership for having that foresight.
Gotcha. As a final question, Dr. Chang, with everybody continuing to do their own due diligence about the vaccine, I think people in general have been a little surprised that healthcare providers there's been more declining the vaccine than we would have thought. Do you have any comment about that or any insight for us?
Yeah, one of the biggest fears from all of us, right, in the field is vaccine hesitancy. And as a pediatrician, I've been dealing with the anti-vaccine crowd for decades now. And with anything, it's that curve where you're going to have these people will always do what you ask them to do. These people will never do what you ask them to do. It's the people in the middle, and they choose to believe or not. And the goal is to get that threshold over a certain point. And so luckily in the past, the anti-vaxxers have been that small population. I think the biggest challenge has been the internet. So now, whereas before they were packets of conspiracy thinkers, flat earthers, whatever you want to call it, right? That would be over here and they can only communicate through phone or through group meetings or something. Now the internet opens it up to anyone posting anything about any topic with any opinion. in certain ways. So if we were to Google autism and vaccinations, I bet the first 2-3 dozen would be these sites that may be pitching false information rather than getting to the CDC, to the American Academy of Pediatrics, the ACIP, truly valuable sources of good information. And it's gotten to the point that even faulty research is out there with other directives. So it's difficult for, I think, people to get the good information. The goal then, I think, is to go back to your healthcare provider. And hopefully your healthcare provider knows you, knows your family, knows your personal health situation, and can advise you on the safest steps towards vaccination. We've learned as a community to just boldly go against someone, to say that you're crazy, you don't believe in science, that's all voodoo, pushes them in the wrong direction. And they're probably more inclined not to become vaccinated. For me as a pediatrician, what kept me grounded was, once again, if this parent feels so strongly about their child's health, that's a great thing. If their mind is telling them that a vaccine is doing harm to their child, then I kind of have to support their perspective as a protective parent. But let's speak about why you have that fear. And hopefully you can trust me to share with you good information, evidence-based information. And there were many conversations I've had where it's that first conversation starts to build the bridge, and then eventually you get to the point where their trust of what you're presenting to them, without just throwing all of their ideas and thoughts out the window, gets me to the point that their child is being vaccinated. And maybe if it was just face to face with a very confrontational parent who's like throwing accusations at me in my profession, I would have slammed the door. But I couldn't do that when I knew that an innocent child's health was also at risk. And it allowed me to build a bit of a bridge there. I think we need to do the same now. So there are certain populations we know that kind of from a cultural basis have challenges with understanding vaccines or have faith in vaccines. I think we can target certain populations with culture, with language, with opportunity to answer questions openly, honestly. So not trying to say this is going to, solve everything and this is the perfect thing, but giving real numbers about efficacy and side effects and expectation to make sure, because in the big picture, for us to get back to normal or our new normal, the vaccination rates are a huge component of that. Even my own family, no joke, I got a call right before this meeting from my uncle, who luckily got his first dose, but he's like, hey, Alberto, he calls me Alberto. I got my first shot, but this second one, I'm hearing crazy things. What do you think? And I was able to tell him, hey, uncle, right? Thanks for calling me, number one, but let's talk about it. What has you concerned? This is what's real. This is what might happen. Let's just be smart. So those open conversations, and this is where for you all, we're all in opportunities to kind of promote good information. Number one, practice good health behaviors, promote good information, and then empower and inspire those around us to do the same. So I think, my request, I want to thank you all for hanging on for this presentation, but as you go back to your homes, your families, your friends, and your communities, keep pitching that great message, the strong message, because that's what we all need to do to get back to our new normal.
Dr. Alberto Chang, thank you so much for taking us on this journey. We so appreciate it. We know your parents are totally proud of you, even though you didn't become an engineer. You're doing great. Keep up the great work. Thank you to all the audience members for their questions and comments. Please, you'll receive an email questionnaire. Please fill it out. We totally appreciate getting your feedback. We really value it. And don't forget to check when you Google UCI, What Matters to Me and Why for future programs. Upcoming is on March 10th, Pulitzer Prize winning author Jack Miles, and also on February 25th, UCI Health Series with Dr. Shruti Gohil. So thank you very much. Have a wonderful rest of your day. Stay safe and wear double masks. Thank you. Thank you, everybody. Thank you, doctor.
Thank you all.